Welcome to our annual Coaches Education for Concussion in Sport. Today's presentation will go over a brief introduction. We'll discuss Louisiana Youth Concussion Law. We'll go over signs and symptoms of a concussion in Concussion 101, as well as our specific program with Ochsner Lafayette General. Louisiana's Youth Concussion Law, or Act 314, encompasses any youth athletic activity where the participants are 7 to 18 years old. It has annual education requirements for coaches, officials, volunteers, youth athletes, as well as parents and guardians. Coaches, you're doing this online education today. Parents and athletes have take-home info sheets that are included in their physical packets. Louisiana Youth Concussion Law is going to talk about the removal of participation when any athlete reports or signs or symptoms of a concussion is observed. The coach, athletic trainer, or game official has a responsibility of removing the athlete when signs of a concussion are present. A coach or official also has the responsibility to remove an athlete if they're told the athlete is exhibiting symptoms by any of the following persons: a licensed, registered, certified medical healthcare provider within their scope of practice. This person may be a volunteer, or any other licensed, registered, or certified individual whose scope of practice includes the recognition of concussion symptoms. This person may also be a volunteer. Once the student athlete is removed from participation, Youth Concussion Law is going to talk about that athlete needing to be evaluated by a licensed healthcare provider. Whether it's the MD or DO or the athletic trainer, someone needs to put their eyes and figure out if it's a sports-related concussion. If sports-related concussion is suspected, we're going to send them for evaluation by an appropriate physician. Once the athlete is removed from play, it's going to dictate a graduated return process. The student athlete isn't going to be able to get cleared and all of a sudden fully return to athletic participation. That student athlete is going to have to go through a gradual return both physically and cognitively in the classroom. Concussion 101, we're going to go over how to recognize the signs and symptoms of a concussion, the necessity of obtaining proper medical attention for a person suspected of having sustained a concussion, as well as the nature and risk of concussions, the dangers of continuing to play in the video on the next slide.
Concussions. A concussion is a mild traumatic brain injury that can occur from a direct blow or a jolt to the head or body. This can be a result from a fall, hitting a hard surface, coming in contact with a ball, or even with another person. Concussions are diagnosed by licensed healthcare professionals. A concussion is a chemical injury to the brain, not a physical injury to the brain, thus cannot be detected by imaging. Imaging may be used in special circumstances to evaluate for other injuries, but is not required for a concussion diagnosis. Think about your brain as a soda bottle. Sustaining a concussion is just like shaking up a bottle of soda. You want to allow that bottle to settle down. The same goes for a concussed brain. Don't shake the bottle. Concussion symptoms can be classified into several different categories. Physical symptoms may include headache, fatigue, pressure in head, neck pain, nausea, vomiting, dizziness, blurry vision, and sensitivity to light or noise. Cognitive symptoms may include difficulty concentrating, difficulty remembering, not feeling right, feeling foggy, drowsiness, and confusion. Emotional symptoms may include nervousness, anxiety, irritation, and sadness or depression. Concussions may also cause sleep disturbances, such as difficulty falling asleep and not being able to stay asleep. Every individual will experience symptoms differently and may experience some or many of these symptoms. Call 911 or go to the emergency room immediately if a person with a concussion has repeated vomiting or increasing nausea, is excessively tired or cannot be awakened, develops slurred speech, convulsions, or seizures, becomes increasingly confused, restless, agitated, or has unusual behavior, has amnesia of recent events, or loses consciousness. Recovering from a concussion takes time and proper management as guided by your doctor. Recovery recommendations include getting at least 8 hours of sleep on a normal schedule. Sleep is encouraged to give the brain rest. Stop participation in sports or physical activity until safely cleared by a healthcare professional. Limit time playing video games, watching TV, texting, or any other activity that involves concentrating on a screen, as these activities may increase symptoms. If you are of driving age, don't drive for at least 24 hours after sustaining a concussion, and avoid or limit driving while symptoms persist. Driving with a concussion can be dangerous. Maintaining good eating habits and staying hydrated is also needed for the brain to heal. Don't skip meals and drink plenty of water. School modifications may be necessary to give your brain the rest it needs while still attending normal days of school. A doctor can help with these modifications. When recovering from a concussion, a good rule of thumb is, if it makes symptoms worse, avoid it. Once your brain recovers fully, you will be able to return to normal activities as guided by your doctor. Just like a snowflake, every concussion is unique. Recovery time will vary depending on the severity of initial symptoms and how well you follow management recommendations. Recognizing and recovering from a concussion is very important. Sustaining a second concussion before fully recovering from the first concussion can result in second impact syndrome, which can be fatal. Not properly recovering from a concussion can lead to extended duration of symptoms and even cause long-term deficits. Be sure to follow all recovery recommendations as guided by your doctor.
Recent literature also shows that concussion symptoms come in 4 different categories: physical, cognitive, emotional, and sleep disturbances. We also want to be on the lookout for emergency referral symptoms with an athlete of a suspected concussion. These emergency referral symptoms include repeated vomiting, excessively tired or can't be wakened, any slurred speech, unusual behavior, amnesia, or loss of consciousness. Any of these items show up with an athlete suspected of having a concussion, that athlete should be referred to an emergency facility for further evaluation. Now a little bit about our concussion management program at Ochsner Lafayette General University Hospital and Clinics in partnership with Concussion Solutions. We offer schools, organizations a comprehensive coverage with a timeline and best practices protocol. We include impact baseline testing. We have updated our return to learn protocols this summer. Looking forward to introducing that to all of our academic and school administrators. Includes return to play protocol. We have general consultation of concussion management to our area athletes. We also have additional professional resources through our concussion physicians at UHC, as well as consultants across the U.S. So an outline of our timeline and best practices. Our timeline starts off preseason with annual baseline testing and education. This is a part of that section, this video. Testing is completed for at-risk sports. We also provide education for athletes, parents, coaches, administrators. Samples of that education is seen here. All the way to the left, you will see our Louisiana Athletic Care Emergency Contact Form, accompanied by their serious sports injury education sheet. In the middle, you'll see our student and parent education for concussions. In the past, this has been 3 to 4 pages long. We've narrowed that down to 1 page. So from emergency medicine and education standpoint, our pages are down to 3 total. All the way to the right, you'll see some examples of handouts for teachers, academic administrators, as it relates to the athlete recovering from a concussion in the classroom. At the time of injury, our athletic trainers, or in the absence of, a coach will recognize, remove the athlete from participation. If the athletic trainer is there, they'll evaluate them. Know that a thorough athletic trainer concussion evaluation could range from 10 to 15 minutes total, and it's always best if it's done away from noise and distractions. Communication with the parent or guardian if a concussion is suspected is important. We want to give them take-home instructions and what to expect from symptoms and what to look out for from emergency referral checklist. The initial 48 hours is going to promote simple rest for the athlete, basic daily activities, nothing too strenuous. After that 48 hours, the athletic trainer can get them into the physician's office for official evaluation. and establishing a game plan as it relates to return to learn as well as return to athletics. At the time of the injury, the athletic trainer is going to give the student athlete and parent guardian one of these two sheets. On the left, you'll see the sheet for our Louisiana Athletic Care athletes. On the right, you'll see the sheet for athletes falling outside of our coverage umbrella. The initial physician evaluation, when it's done with our UHC physicians, we like to get that scheduled within the first 48, 72 hours after injuries. Our visits are focused on athlete and parent education, as well as large portions of the initial assessment. We're going to establish education with the parent, discuss symptom trajectory, and we're also going to create the plan for any academic accommodations. Note that academic accommodations are going to evolve over time and be a trial and error process, in that we're going to have to see what exhibits or what elicits symptoms from the student athlete and adjust their activities from that. This is where constant communication between the athletic trainer, the athlete's teachers, as well as the coaches plays a huge role in determining the recovery standpoints of a student with concussion. Recovery and healing results vary from athlete to athlete. They'll all be individual. Symptoms range from 10 to 14 days. Once you see that symptom trajectory start to decrease, symptoms will come in waves, and the waves will get farther and farther apart and less over time. Whatever the student athlete does, the concussion will heal itself. However, if the student athlete is going to fight through symptoms, continue to play sports, or just really drain their brain through this energy crisis, that could prolong recovery, which is why it's important to establish a plan early and follow the plan under the appropriate physician's care. Return to learn. We know that concussions are both a medical and educational concern, as in addition to the athletic component. We want to assess their problems with learning early on and make it a collaborative effort. We know that treatment is individualized from previous slides, and we talked about it being a trial and error process. Determining what cause and symptoms will be important. Return to learn protocol initiates after being evaluated by a licensed healthcare provider. The student should be granted adequate time to complete missed academic work following recovery. Details on what is an appropriate adjustment for a student athlete will be given to you by your athletic trainer. The student should report to their athletic trainer or case manager daily in order to monitor symptoms and assess school tolerance. So that way the academic plan could be adjusted where needed. Return to play. Once the student athlete is asymptomatic in the classroom, once the student athlete is asymptomatic through subsymptom therapeutic exercises, once they are back to baseline at their impact scores, once they have a balance score within their normal range, they are considered for clearance to return to athletic activity. This return to athletic activity is a 5 to 6 stage process. Graduation to the next step is accomplished by remaining asymptomatic through the workout stages. If symptoms return during the gradual return, it's not an end of the deal. We just repeat the level of participation that the athlete succumbs to symptoms on the next day. Should that athlete get in a rut and they're not able to continue activity without a return to symptoms, that athlete would be encouraged to return back to our office or their attending physician for follow-up evaluation. It's not safe to rush the process. Secondary impact syndrome is increased in possibility while you have a concussion. Should an athlete sustain another concussion while recovering from the first one, that athlete's symptoms could jump up exponentially and prolong that athlete's recovery for a really long time. Schools with no AT access make management of the athlete slightly difficult for the physician, but protocols should still be followed. In these instances, we could utilize our physical therapy clinic or one of our providers to run a graduated return process. And here's a brief example of what the graduated to return to sport process looks like. It starts off with very simple symptom-limited activity. These are daily activities that do not provoke symptoms, and increase all the way to a full contact practice being supervised by the athletic trainer. Once all stages of the return to sport progression is complete, that athlete is given a full clearance to return to sport without any restrictions. Again, going over this process, once the athlete completes the gradual return, the physician's note will be sent to the athletic trainer to be kept on file at school. This concludes the concussion education portion of annual coaches education. I want to thank our partners at Ochsner Lafayette General Sports Medicine, as well as our partners at Lafayette General University Hospital and Clinics and Concussion Solutions for providing the framework for our student athletes to compete and return in a safe and adequate environment. Thank you all, and I hope you have a great year.